Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I have got a hot topic for you today. I want you to imagine yourself getting ready to watch your favorite TV show. You grab your remote control, you press the up button to change the channel, and all of a sudden the channel goes down. You think, I know I just pressed channel up. Why is it going down? So you press channel up again, and what happens? It goes down to the next channel. You think something is off. Well, that's what happens when we have endocrine disruption occurring, and I'm going to tell you all about this. There was a brand new study that just came out in the Lancet Journal, and the Lancet Journal is one of the oldest journals out there. It's been around since the 1800s. So when it comes to very well-respected, well-regarded, peer-reviewed research, the Lancet is one source that you definitely can count on. I'm going to tell you all about this today. I am Amanda Williams, MD, MPH, and I want to talk about endocrine disruptors. So now you think about this. You think, okay, I'm getting ready to tune into my favorite TV show and can't seem to get to the channel. What is happening? Something has gone awry. Well, that is exactly what happens when the body is bombarded by different chemicals. And these chemicals are known to create endocrine disruptions. So what is the endocrine system? The endocrine system is the system that contains all of your endocrine glands that release hormones into the bloodstream. Remember, your hormones are going to be working like chemical messengers. So without the proper release of those hormones, we're not going to get proper messaging. So it's kind of like you're pressing the channel up and it keeps going channel down. So we know that something is being disrupted in that signal. The same thing happens when the body is exposed to all of these different chemical agents. And that is what we have been talking about for years, knowing that all of these different chemicals that are found in everyday products that we as human beings are using, things in our lotions, shampoo, makeup, so many ways in which we are exposed. Cooking materials, so things that are leaching out of pans, out of plastic, all of the ways that we are exposed to this, and the long-term health effects are really starting to come to a head now, and people are starting to realize that we need to take warning on this. So in the Lancet, just this week, they were talking about these endocrine disrupting chemicals and how there is a really substantial cost to society in terms of disease states and disability, and understanding that many of these toxicants that are found in commonly used products, health and beauty products, are classified as carcinogen, so meaning that they are cancer causing. We know this. So why is it that we are still being exposed to it? That is the million-dollar question. But what we do recognize from all of the many years now of research is the actual exposure and the outcome that is associated with that. So when we're looking at all of the different health conditions that can be correlated to these chemicals that are found in so many things that we are applying to our bodies, that we are taking in via from foods, all of these ways that we are exposed to these harmful agents. And now we recognize those direct human causal effects. And it is really frightening when you see how you can look at impaired glucose tolerance, when we can look at diabetes, when we look at obesity, and all of the things that they've been able to directly correlate to chemical exposure and these disease states. There is a relationship between things like bisphenols and diabetes and reduced semen quality, for example, which then we're looking at issues with fertility, which makes an awful lot of sense. Because remember, the endocrine system, that is your hormone messaging system. So all of the different glands that secrete hormones. So we think about our pancreas, obviously, then we're going to be dealing more with those metabolic issues, such as insulin resistance, such as diabetes. We can even look at gestational diabetes. That's diabetes that's brought on due to pregnancy, but they've been able to correlate, once again, the exposure to different chemicals. We can tie in things like PCOS, which is polycystic ovarian system, looking at phthalates that are laden in so many different products and how that has led to significant impaired glucose tolerance, looking at organophosphate pesticides. I talked about this just recently on another episode on quercetin and how they've been able to show quercetin to be very effective in targeting organophosphate exposure. So we know that we have all of these different exposures. We know that there are things that they put on our clothes, different flame retardants. There's so many different things to which we oftentimes kind of just go about our day and don't even recognize all of the ways in which we can be exposed to these harmful chemicals. So a lot of times people are starting to recognize things like parabens and phthalates and where we potentially are getting exposed to these things. Most people have heard of BPA when you think about plastic bottles. So the bisphenols. So when it says BPA free, well, why is that? Because they know that the chronic exposure to BPA is directly linked to so many negative health effects, including things such as cancer. So we know these things, and we look at phthalates, and phthalates are commonly put into so many different products, including many of the different things that they call fragrances. So if something has a fragrance to it, then you know that that has a phthalate. So there are different companies out there that basically mask their products with all these different fragrances, and they do not have to report that because in that particular industry, it's not required that they report that, which is really very alarming. There's a group called the Environmental Working Group, and they tested all of these different products from 72 name brand, commonly used formulas that people in this country utilize, and they found that nearly 3/4 of those products contained phthalates. So what does that mean? Fragrances. And knowing those long-term effects, understanding the damage that that does at that cellular DNA level. So when we're looking at the issue with sperm, when we're looking at insulin resistance, remember what those hormones are doing. They are sending those chemical messengers. So having this type of exposure is really incredibly problematic. So I use the example of you're just sitting there trying to watch TV and your remote control's not working properly. Can you imagine if all of the glands in your body that are required to secrete out these different hormones are being disrupted because of things that we are doing ourselves, things that we are exposed to, putting lotions on, shampoos, the types of soap that you are using, the types of pans that you might be cooking in, the things that you're storing your foods in. These are all ways that we are exposing ourselves to this. And it's really frustrating because when it comes to the regulation of these, it's really not well regulated. And companies are not required to disclose these types of chemicals. And that's really, really unfortunate. So you look at all of these ways in which we are continuously and repeatedly having this type of an exposure. I always use the example when you think about, 50 years ago, and you look at the types of cancers that were out, and you look now, and you look at the rates of infertility, for example, in this country, as opposed to 50 years ago. You have to draw those correlations between what environmental factors are screwing everything up. And it comes down to all of these things. The parabens, for example, this is something that you find in so many different body care products and cosmetics out there. And seeing, once again, the direct correlation between parabens and breast cancer, seeing the correlation between parabens and reproductive health issues. And we see all of these things. We can test different hormones, and we can see the impact that those hormones can have because of that chronic exposure. And so it really is very frustrating, but also very alarming. And so when the Lancet came out this week with their findings, looking at the long-term implications for human health, it did catch my eye because I've been talking about this for many years. And so whenever you see the extensive research being kind of all populated and pulled together, it's a really nice thing, because you hope that it's going to start to spread throughout the scientific community, that people are going to be more aware of this, and more physicians will be able to talk to people, and we can start to talk to industry leaders and say, hey, we do not want these chemicals in our products. We understand that it's saving you a couple of bucks, but we do not want that exposure that is leading to obesity, leading to disruptions in our metabolism, leading to infertility, and all of these problems that we know. Now, there was a study that they did out of George Mason University a couple of years ago that was really interesting, looking at how the different chemicals in beauty products can harm women's hormones. So in this study, what they did is they set up this experiment where they were looking at the link between chemicals that are widely used in cosmetic and personal care products and changes in reproductive hormones. So they were doing urinalysis of women, and these were women between the ages of 18 and 44 years old who were all free of any known chronic health condition, and they were able to determine their exposure rate in terms of different personal care products that contain things such as parabens, that contained things such as phthalates, for example. And then they assessed their urine, and they were looking for any type of detectable levels. So through doing this type of a multi-chemical approach, this was really reflecting this real world environmental exposure that showed even low level exposure to these different chemicals can affect reproductive hormone levels, which I think is really noteworthy, because when we talk about levels of infertility in this country and the rate of infertility, it's not somehow just a women's issue. This is a male issue too. I just talked about how the exposure to these chemicals can also lead to issues with sperm. So we know that this is affecting both men and women. And so what you want to be able to understand from a study like this out of George Mason University is that we need to be very careful about the chemicals that we are exposing ourselves to. And luckily nowadays, we do have a lot more options, which is why I've always been incredibly impressed with the Invite Health beauty line. So anything within our cosmeceutical line is free of any phthalate, paraben, alcohol, no chemicals whatsoever. So if you're using our shampoo, our conditioner, our lotions, face wash, any of those, you are not going to have that type of an exposure. So we know that it doesn't contain any of those known endocrine disruptors, which is certainly very, very important. Then we think about, okay, well, we know we have been exposed in the past. Maybe you were unaware of this. So what can you do? Well, then you want to make sure that you're taking proper nutrients. That, number one, you're eating the right foods that are high in antioxidants. Things like cruciferous vegetables, for example, we know are very beneficial. So things coming from broccoli and spinach and cabbage and kale. Those cruciferous vegetables do so much to support cellular detoxification. But we can also look at things like quercetin that we know targets organophosphates. We can look at things such as N-acetylcysteine, NAC, which we know is also very important when it comes to supporting those hepatocytes. So your tiny little liver cells that have to filter through all of this junk. So the more junk that is building up, the more disruption will actually occur within the endocrine system, leading to things such as male reproductive health, female reproductive health, metabolic system disorders, diabetes, insulin resistance, all of these things that we know are directly related to the exposure to these chemicals. And study after study, and so this is why this Lancet study that just came out this week was really quite interesting, because it was looking at specific exposures to BPA, for example, and looking at the direct correlation between that BPA exposure and fertility, looking at organophosphate, pesticide exposure, and looking at the correlation once again to things like prostate cancer, looking at different types of hormonal disruptions that are directly caused because of that exposure over time. This is something that we as Americans should really care a lot about. We should care that when you're using a shampoo or you're using a conditioner or a food that you're eating, you want to make sure it hasn't been sprayed by all these harsh chemicals that are still allowed to be used in our products, which is absolutely ridiculous. But this is just something that the more we know, the more we're educated about things, the better off we are. Because one thing that we do know is that more and more science continues to show that these endocrine disrupting chemicals, these chemicals that are directly capable of interfering with the proper hormone action, which can contribute to disease and disability, that we need to be proactive in that. We need to make sure that we are taking the appropriate actions, that we are supporting our liver for proper detoxification with things such as NAC. You can go to our website and check out our daily detox powder, for example. That's another really great option, which has some of those wonderful nutrients that help to optimize the way that your liver handles those types of chemicals. We want to make sure that the body can rid itself of those. We want to remove the exposure. So not using products that contain that, using products that we know are clean and free of any of those agents. So I wanted to just bring this to your attention today because it is something that I think oftentimes people aren't even aware of. Many times people take vitamins and minerals and they're taking their supplements on a regular basis. But then if you were to look and see what type of shampoo or what type of lotion, or maybe, if you're a female and you're wearing makeup, what's actually contained in that and how that's impacting all of your hormones. So you might be thinking, hey, I'm doing everything right. I'm exercising, I'm eating right, I'm taking my supplements. But yet we're still creating this situation in the body where we're having disruption in that proper chemical messaging system. So if the hormones themselves are not doing what they are meant to be doing, that will impact your overall health. Hormones are so critical to our general well-being that if those functions are skewed in any way, the body will pay the price for that. So I want people to be educated, be smart in terms of, as a consumer, knowing the types of products that you are purchasing, understanding that you want to limit your exposure when it comes to the way that you're storing things, ideally storing things in glass as opposed to plastics where we potentially have that leaching out of those chemicals. Be smart. Think about what you are doing every single day. And you can always do your own research. Utilize the database that the Environmental Working Group has. If you're not sure about what a chemical is, type it in and look and see just how harmful a potential chemical can be to your health. And the more you know about that, the more likely you are to stay far, far away from those types of harsh agents. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health Podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and leave us a review. And you can also follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health Podcast.